It was a parent's nightmare, a 3-year-old with high fever that wouldn't come down, and one hospital after another too busy to treat him until they found a walk-in clinic that could.
Going around and just trying to find help, begging on doors. Like, I can't believe that in 2022 that's what we're doing.
A surge in kids' respiratory infections, especially the flu, continues to stretch resources at pediatric hospitals across the country, with admissions 10 times higher than usual.
12 children's hospitals are tracking data. In the last week of November, we saw 223 admissions to the hospital for children suffering from side effects of the flu. This number would typically be 10, 11, 12 kids a week.
The evidence of crisis is everywhere. Ottawa's Children's Hospital of Eastern Ontario bringing in the Red Cross this week to support staff. In Calgary, a pediatric hospice discharging its respite patients because staff were urgently needed at the local children's hospital. Stories like those prompting anger and vague responses from the authorities.
We're going to make sure we're listening to the best advice from experts and public health authorities.
Help is coming. Our system is under strain. There's no doubt about that. And this is not just unique to, Alberta's Children's Hospital.
We still have time to blunt the impact of this transmission by getting people vaccinated.
Experts say concrete solutions are needed now.
We have to, number one, increase capacity in our healthcare system so we can absorb these things when they happen. But we also have to try to prevent these things from happening in the first place.
So, Deanna, about those short-term solutions, we know kids' COVID vaccination rates are pretty low. What about the flu shots?
They're not great, Adrienne. In BC, only 20% of kids under the age of 4 got the flu shot. And in Alberta last week, only 12% of this vulnerable age group got the immunization against the flu.
Okay, so another proposed measure, of course, is masking. Not a lot of political will to bring back mandates, but what do the health experts say?
You're absolutely right, Adrienne. This is a political hot potato that nobody wants to touch. That includes the school boards. In fact, a few school boards tried to pass the mask mandate for their schools only, and even those couldn't get through. Too much opposition. But experts say masks do help, especially in crowded indoor settings, and especially if you're not feeling 100%. Adrienne.
All right, Deanna Sumanac-Johnson, thank you. Take care.